So this is an example of the nuchal ligament enthesiopathy, or where a ligament attaches to a bone and there's bony remodeling. And here you can see it at the top of the pole. This was a warm blood hunter jumper mare, reluctant to go forward, didn't want to accept the bit, would push out with its nose and not want to come into a frame. And then when you asked for collection, it actually reared. So very unusual for this sort of thing. So once we were able to diagnose what the problem was, then we were able to treat this. And this is truly this was so difficult to treat prior to Shockwave. You'd inject cortisone, and you're injecting cortisone with a needle into an area where the spinal cord is only about another inch below. So it was a concern treating it with a needle. And the first time I ever did this with Shockwave, I was very concerned because I'd never done it. I called a German friend of mine and I said, "Are you sure this is okay? This horse isn't going to rear up and go over backwards or anything." And he assured me, even though I called him multiple times about it, that it was going to be fine. And sure enough, these horses just go to sleep under the sedation. You Shockwave them, you put them back to work a week or two after. They go back to work, everybody tells you the problem's over. Most of these horses we don't retreat. So it's a magic cure in that regard to this problem. And a problem we didn't have a good solution for before. So this has been great. And here you get to see what a normal one looks like on the left, and then you can see what the abnormal one looks like on the right. And that's what the probe placement looks like in the live horse and in a skeletal specimen.